That's correct, Gil. Anatomy and physiology. This artery and its branches are the only arteries in the adult that carry DH at risk.
Pulmonary artery.
That's exactly what it says. Category is diagnostics. Tensilon is used to confirm what disease?
Myasthenia gravis.
Yeah. Take a look at your screen. The category is diagnostics. Which artery is the big at risk?
Ulnar.
They're right. Category is patient assessment. Besides crackles, rhonchi, and wheezes, what other adventitious at risk?
Bronchial.
I can't take that. They're at risk. Patient assessment. Besides crackles, rhonchi, and wheezes, what other adventitious breath sound can be heard with fungal diseases?
Pleural rub.
That's what it says. Give them a break. Neonatal pediatrics. You're caring for a neonate weighing 2,500 grams. Please tell me what ET tube.
Size 3.
Not correct. Neonatal pediatrics. You're caring for a neonate weighing 2,500 grams. Tell me the ET tube size.
3.5.
That's right. Listen closely. Given an ABG sample with a pH of 7.56, of CO2 of 44, and a bicarbonate of 30, interpret.
Partially compensated with metabolic alkalosis.
Stop the clock. Let's use the judges for their listen. All right, thank you. That's incorrect. Diagnostics. Given an ABG of 7.56, CO2 44, and a bicarb of 30, what's your interpretation?
Uncompensated metabolic alkalosis.
Thank you. Anatomy and physiology. What type of specialized myocardial tissue conducts impulses at risk?
Cardiac cells.
It's not right. Anatomy and physiology. Let me finish the question. What type of specialized myocardial tissue conducts impulses rapidly to ensure synchronous, continuous contraction of the ventricles?
SA node.
I'm looking for Purkinje fibers. Categories gas therapy. What are the two primary factors that determine the harmful effects of oxygen?
Concentration and duration of therapy.
Stop the clock. All right. The judges are going to take that as being correct. Let's go visual. Take a look at the screen. Categories airway management. What component of the endotracheal tube is the...
Murphy eye.
That is correct. Emergency care. What does AED stand for? At risk.
Automated external defibrillator. Automatic external defibrillator, or
I'm going to not take that. Sorry, let me finish the question. Emergency care. What does AED stand for? And what's the first step when utilizing this device?
Automated external defibrillator and turning it on.
Give him a point. Categories gas therapy. What's the oxygen air ratio for? Yeah. Can't take it. Gas therapy. What's the oxygen to air ratio for 60% of oxygen?
1-to-1.
Yes, give him a point. Patient assessment. What life-threatening condition exhibits a hyper-resonant percussion note?
Tension movement.
Yeah, give him a point. Take a look at the screen. We're going visual. Uh-oh. Stop the clock. Here's a slide we're looking for. Thank you. Back on the clock. Categories mechanical ventilation. This patient's being non-invasively ventilated with a McKay servo I ventilator using NAVA. What does the acronym NAVA stand for?
Neurally adjusted ventilation assistance.
I'm going to take that as being correct. Categories airway management. When extubating a patient, the endotracheal tube should be withdrawn at what point in the breathing cycle?
Deep inspiration.
Yeah, I'll take that as being correct. What is a condition in which the pulse rate is less than 60 beats per minute?
What is bradycardia?
Sometimes they're just that easy. Humidity and aerosol. What is the absolute humidity of water at 37 degrees? At risk. I'll take that. Mechanical ventilation. What is respiratory rate divided by tidal volume, more commonly known as? At risk.
RSBI, rapid shallow breathing index.
It's used to wean a patient off of that.
That's what I was looking for. Good job. Neonatal pediatrics. What is the vessel that joins the pulmonary artery and the aorta at risk?
Ductus arteriosus.
That's it, give him a point. Anatomy and physiology. What is the total volume of gas that moves in and out of the lungs at risk?
What is tidal volume?
No, that's not what it says here. Let me finish the question. Anatomy and physiology, what is the total volume of gas that moves in and out of the lungs in a minute called?
Minute ventilation.
That's right. Let's take a look at the screen. We got another visual for you. Name that drug. This drug may lead to metabolic alkalosis. It blocks the reabsorption of sodium in the ascending loop of Henle.
Lasix.
That's right. Oh. Pharmacology. What antibiotic is MRSA resistant to?
Penicillin?
What was that?
Penicillin.
No, I'm sorry. Category is pharmacology. What antibiotic is MRSA resistant to?
Methicillin.
Yes, give him a point. Microbiology. What bacteria is a normal inhabitant of the intestinal tract at risk?
E. coli.
But it doesn't matter, they got it right. Chemistry and physics. Define pH mathematically.
It's the amount of hydrogen ions in a solution coming from an acid.
I'm not going to take that. How is define PhD or define pH mathematically?
Bicarb over the CO2 with the carbonic acid.
I'm looking for the negative log of the hydrogen ion content. Categories, name that. If you examine me, I will get worse. I usually transmit it by Haemophilus influenza type B. I'm life-threatening. At risk.
Epiglottitis. And it's more in children than adults.
I can't take it. Name that. If you examine me, I will get worse. I'm usually transmitted by Haemophilus influenza type B. I'm life-threatening. I'm characterized as swelling just above the vocal cords. What am I? Looking for acute epiglottitis. Diagnostics. Ooh. What accounts for more than 80% of all bacterial pneumonias?
Streptococcus.
Give them a point. Let's look at the screen. Other way. Other way. I'm off. There we go. Categories pathology. Identify the pulmonary disease by these pictures.
Tuberculosis.
That's what it is. Patient assessment. What is platypnea?
It's pain when you sit up and relaxation when you're laying down, which is dyspnea when you're sitting up.
Okay, you're correct. Thank you. Emergency care. I'm an antiarrhythmic agent. I affect sodium, potassium, and calcium channels. My initial dose is a 300 milligram bolus. What am I? experts. The posse is coming in.
Adenosine.
I'm sorry, that's incorrect. Over here, emergency care, I'm an antiarrhythmic agent. I affect sodium, potassium, and calcium channels. My initial dose is a 300 milligram bolus. What am I?
You are amiodarone.
That's what I am. Arroyo. Anatomy and physiology. What is the opening in the mediastinum through which the main stem bronchi at risk?
Hilum.
Yeah, it doesn't matter, they got it right. Category is chemistry and physics. I think it's gas therapy. What medical gas comes in 80-20 mixture at risk?
Heliox. It's used for increased airway resistance, asthma.
I'll stop you there. Category is gas therapy. What medical gas comes in an 80-20 mixture and how is it spelled?
It's Heliox and it's spelled Heliox.
Yellow point. Yellow pediatrics. What's another name for laryngotracheal bronchitis? Audience.
Croup.
Give him a point. Anatomy. Stop the clock. Audience, please.
Audience, it's not your game to play. So if we hear answers up here, we have to throw the question out. That penalizes the team that has the correct answer. So
Yeah, be careful with that. Okay, here we go. Back on the clock. Anatomy and physiology. Negatively charged ions migrate to the positive pole of an electrode. What are these ions called?
Anions.
Yes, give them a point. Take a look at the screens for another visual. Diagnostics. What condition is this sign?
Croup.
Yes, give them a point. Category is patient assessment. Pulsus alterans is suggestive of what disease?
Left heart failure.
That's what it says. Pathology. How are vector-borne diseases transmitted?
It's from a surface to a host to a victim, basically. It's found on the surface.
Stop the clock.
How much time is left? 4 minutes. Now they do the double.
Judges say no. Pathology. How are vector-borne diseases transmitted?
You want to ask our posse?
They're going to ask their posse. Oh, the posse says, oh.
Fomites. Fomites.
No, I'm looking for transmission through an animal, especially an insect, and they transfer it from one host to another. Okay, we're in 4-minute penalty phase. Bonus phase, I'm sorry. We're going to start with a visual. Take a look at your screens. Patient assessment. Which of these pulse sites is usually used to determine heart rate with a stethoscope?
Apical.
Give them 2. Patient assessment. What is the term for an excessive drop in blood pressure associated with an individual standing up?
Hypotension. Hypotension, right?
Orthostatic hypotension.
So good, I'm giving you 2. Emergency care. What's the correct ratio of compressions to ventilation on an infant?
15 to 2.
That's right, give them 2. Nanophysiology. What parameter expresses the distendability of the lung?
Compliance.
Yeah, give them 2. Neonopediatrics. Transillumination is often used to diagnose
Pneumothorax. Tension pneumothorax. Or hyperresonance.
Stop the clock. What was it?
Okay, audience, we gotta keep it down so both of you can do the question.
It's basically looking for air under the skin for a baby for in case of a pneumothorax.
Give them 2. Gas therapy. This is a disposable plastic device consisting of 2 tips or prongs, primarily 1 centimeter long, that are connected by several feet of small bore tubing.
Nasal cannula?
That's what it is. Take a look at the screen. This tracing is obtained during mechanical ventilation. What condition?
Autopsy.
It is autopsy. When patient assessment, when reviewing your patient's EKG, you notice the P wave is absent and the atrial contractions appear disorganized and ineffective. What rhythm should you suspect?
Atrial flutter.
Can't take that. Patient assessment, when reviewing your patient's EKG, you notice the P wave is absent and the atrial contractions appear disorganized and ineffective. What rhythm should you suspect?
Atrial fibrillation?
That's what it is. Airway management. What organization provides CPGs for endotracheal suctioning of mechanically vented adults and children with artificial airways?
About to die. I have 1% left.
It's the AARC. Patient assessment. What is chest pain associated with inspiration called?
Pleuritic?
That's what it is. Patient assessment. What sign of diaphragm fatigue results in an inward movement of the abdomen?
Abdominal paradox.
Yes. Patient assessment. What is mucus that comes from the lung but passes through the mouth and is expectorated?
Sputum.
That's what it is. We're playing it. Neonatal pediatrics. This genetic disease is caused by mutations in a pair of genes located in chromosome 7.
Cystic fibrosis?
Correct. Airway management. How should laryngeal edema be assessed prior to extubation? Yeah, give them 2. What anatomy and physiology, what is the distal portion of the soft palate called?
Uvula.
Yeah, give them 2. What is the term, patient assessment, what is the term that describes a body temperature above the normal range?
Febrile.
Stop the clock, it stopped. Judges, take it.